You're tuned into the AdvoSci Health podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real. Hello everyone, and welcome back to another episode of the ASH podcast. My name is Omar, and joining me today is our co-host Ali and a special guest, Amal. We have the pleasure of hosting our friend Amal here to talk briefly about a topic that is currently and probably will affect us all in the future, and that is one about medical innovation and global health. So before we dive in, Amal, feel free to give our listeners an introduction about yourself, your academic, personal background, and just, what are you up to these days?
Thank you so much, Omar. It's so great to be on. Thank you both for having me. So just a little bit about myself is I'm a Master of Science student in the Global Health program, and I come from a background with a Bachelor's of Science and I specialize in psychology, neuroscience, and behavior. So a little bit different to the public health field, but I really wanted to improve my understanding of public health systems and inequities inherent to them. So my interest lies in public health systems and also the individuals that are most affected by these systemic inequities, such as refugees and newcomers. And a little bit about what I'm currently up to is I'm doing my practicum as part of the program with Ali, actually, at the Sick Kids Center for Global Child Health. And we're actually both working on the same project. We're working on the Maternal and Infant Nutrition and Growth Project, which is looking at exemplar countries that have improved the nutrition outcomes for women and their children over the past 20 to 30 years. So a little bit about me.
Yeah. Thank you for sharing. Yes, we are on the same project. Actually, I don't know if I mentioned that to you, Omar, but it's fun. It's a nice project, a lot of reviews, a lot of extraction stuff to do. So, it's been nice. It's been a good learning experience, I think. For me, at least, I've never done a systematic review in that sort of sense before. But I mean, I know we're here also just to talk, but the club that you are representing when you're in this call is called MIGH, or which I think Omar mentioned it, which is Medical Innovation and Global Health. If you don't mind, could we kind of start from the top of, what that is or how that came to be?
Yeah, for sure. So Medical Innovation and Global Health, or MIGH for short, we're an interdisciplinary graduate association, and the keyword here is interdisciplinary. So we all came together. We were recruited by the co-founders, Shruti Chitu and Ritika Ketrapal, and we were basically focused on the intersection of these different disciplines in medical innovation and global health. So how does the Master's of Science in Global Health, how does the Master's of Biomedical Innovation, how does the Master's of Business Administration, how do e-health, how do MBDC, how do we all come together and participate in medical innovation and improving the health of global populations? So we're basically looking at focusing on those areas, and we were founded in early August of last year, and since then we've held multiple events recruiting general members. We attended as the board of directors. We made into teams. We attended two or three case competitions. We've also held our own case competition that I can talk a little bit more in detail about after. We've also had some professional growth events for graduate students, like headshots and research rounds where they get to speak with innovators in the field of medical innovation currently.
Thank you. Just to preface, I was the one who took headshots. I was part of that photography experience.
Thank you so much for that.
No worries. In the future, I will charge for that, by the way. Maybe first time around the free, future it will be charged. Thanks for giving us that background. Omar, any thoughts?
Yeah, no, it's very interesting. I like how you mentioned the stuff about different fields, even with business and e-health, because it's super relevant these days. I think a lot of innovation is being driven from those sectors. But just in terms of yourself, what exactly may have motivated you to get involved in this? Was there something earlier on in your undergrad that kind of drove you to public health? And in terms of leadership aspect with this, that would be interesting to hear as well.
Yeah, thank you for that question. So I am the co-managing director, so I do take on a lot of the leadership role with organizing the board members as well as our executive members. And my interest going into this graduate association, actually, the founders reached out to us to, I guess, kind of recruit us for the team and through a interview process and everything. But what really interested me was I mentioned that I'm interested with health system inequities, and I think crucial to that part of the conversation is that health systems aren't isolated, right? They're built on by a number of individuals, and that includes hospital administration, a lot of people that come with business backgrounds that are looking at the efficiency of a health system rather than solely looking at it from a medical lens. And then you also have, when you think about innovation, you have to think of the different fields that you're looking at. So there's that business side with innovation, but there's also that side of what is needed now, what can be efficiently produced, and what can reach the end user in the most effective way. So that was interesting to me, and being able to have those conversations with other graduate students for a similar goal, such as with case competitions, I think that really interested me in being able to join a team that is interdisciplinary. And I think it really enriched my understanding of how medical practice and how health systems overall function. So I think that gave me a different side to understanding how health systems function and how we need to improve these health systems.
Honestly, it's a really good point. Like, I feel like a lot of people take for granted like how much goes into like building a hospital or making a hospital run. It's not just the doctors, not just the nurses, but there's a lot behind the scenes. So for sure, I think that's like a great way to, get into that idea of like what's going on. And honestly, that's a bit of why, even for me personally, I chose to kind of go into the aspect of like health policy a bit, because that's another thing that affects it. I was gonna ask, like, as a managing director, what sort of your role is, but I could think you kind of already explained it a bit. So maybe I'll just move on to sort of like the next sort of topic that we had in mind, but also which you kind of explained. But the fact that the club is so interdisciplinary, like the way you said that you have like, global health students as well as other faculties going around. Can you maybe give us like, it's hard to say a glimpse, but like an example of how the dynamic is worked between the clubs? Like what do, as maybe a global health student look more into when you're doing club work versus someone else from, the biomedical innovations program, etc., something like that.
Yeah, for sure. I think a great example of that was the case competition. We had an intramural case competition that was hosted by the Global Health Office, and it was like a preliminary round to choose a singular team to go forward to represent McMaster at the Emory University Global Health Case Competition later on in the year. And I think that was the first time that we had a really good glimpse of working together to solve these health issues. And our topic was on Inuit health, and specifically the disparities with food security in the North as compared to obviously the rest of Canada. And so that was a great way for us to really hone in on our skills. So I noticed that, to answer your question, with the global health students, two of us, we were most focused on the health aspect of it, right? What are the most significant drivers of poor health and because of food insecurity? How is this affecting them, not only physically, but also mentally as well, because mental health is also an important factor when you're considering making these health solutions. So I think that we had that health lens and how to achieve that also in an intersectional way, right? It's not just that Inuit people in the North are facing food insecurity, but that it's even more heightened for women in the North, right? It's not just that they're facing food insecurity, it's compounded by the fact that there's a lack of access to primary care physicians in the North, women's health specialists in the North. So we had that intersectional health lens as well. And I think what helped from the MBI side and also from the MBA students that were in our team was that they were able to help us really deliver a very strong pitch, which eventually led for us to succeed in this intramural competition and get chosen chosen to represent McMaster at the MIGH competition later on. And I think their focus was very, making sure our presentation was concise, that it addressed things like key limitations that we're trying to address in our plan, an evaluation strategy, KPIs, a lot of business tools that we hadn't considered before, that we didn't have background in, but I learned a lot from. And that somehow it's now in my vocabulary to say KPI instead of key performance indicator, right? So I think I learned a lot in that sense from the business side, and from MBI specifically with innovation. They had a really good understanding of how to justify an innovation and what it takes to make sure that this is something that someone would want to fund. Obviously we want to improve health problems across the globe, even nationally. But when you propose something new, you want to make sure that it is reliable, that you want the funder to trust that how this product works, that how this innovation will actually target the problem. So I think those two things, that business aspect and also that innovation aspect, is a lot that I learned from my teammates. And I think that we specifically had a very intersectional health lens that they didn't necessarily initially consider.
Good way, it's a good model. You guys do the research, look at the health point, you get the businessmen to do all the getting the funds together, you all just take over the world and make it a better place. Also, I will say thank you for clarifying what KPI was, because I had no clue. You were like KPI, I was like, yeah, KPI. What's KPI?
Just nodding our
First
heads.
week of January, I didn't know either.
I was like, yeah, KPI. Oh, what is it? Because I have no business acumen, business sense, or anything. So honestly, I can see where it would be easier to sort of learn through people in that sort of collaborative sense than just sitting in a class, especially when it's not something you're it's not necessarily a field you're going into. But I mean, I think it's a very good model that you guys have created. I don't know, Omar?
Yeah, I mean, I 100% agree. Honestly, when Amal was talking, Ali, I don't know if you got a bit of flashbacks to Impact, the Impact Club. Okay, why are you looking like that? No, it was a good experience.
Okay, it wasn't bad, but
it was just I think the stuff she was talking about when it came to interdisciplinary collaboration.
Yeah, okay,
resonates a lot with that club, because we worked with even people from rehab sciences. We had engineering students. So being part in that environment, they even teach you their own language. So remember when we were doing design reviews and we had a prototype, we were giving the science stuff about it, but then they were talking about how it would fit in the patient's hand, or would they even want to buy this, would they even want to wear this. So a lot of what was going on for Amal's experience makes a lot of sense, and hers is even more fantastic because working with Inuit populations, doing the groundwork for all of that is really good, because once you're in the real world and you see the field for yourself, it not only gives you a reality check as students who see kind of the neglected pain points that those populations have, but also for your own sense of the future. How do you want to solve that if you are ever put in a position where instead of you are building those innovations, you are now funding? Because some people go on to be the top leaders of their field, and if you're on the other side and you're the one who is mentoring students, how do you bridge those gaps? Just as how this program bridged it for you. You're it's a great learning experience, and I'm glad that there are students who are doing this, because it's something that we need to think about, especially if anyone's worked in healthcare. I know mine's is different. I was a RA in a hospital, but talking about health system efficiency, you don't get to see that as a patient. You just come for care. But when you're working there and you're part of research, and you see the backbone of research and academia are so many different people, you realize that there's a lot of time, effort, and resources that goes into maintaining and sustaining things. And when those things are not sustained properly, then in a pandemic situation, we've seen what happens. So yeah, it's really these different pathways. I think it's good for students to not only think about medicine, but also finding these pathways to explore medicine from a different point of view. And that kind of leads me to what I want to ask about, for the students in this program specifically. Was there anything set up when it came to mentorship, or thinking about if someone wanted to make their an idea a reality, how would they get that guidance for acquiring funding or just sustaining their innovation?
You mean through MIGH specifically?
Yeah, like through the program or your experience. Yeah.
Yeah, I mean, we did have an idea for something like an incubator, like you mentioned, for people to get their ideas out there with health innovations. Since it is the first year the club is running, it's something we considered, but we still have to iron out a lot of details because we would want the participants of that, kind of incubator program to really benefit the most. And I think that would require a lot of, hands-on mentorship from key innovators in the field. So I hope that that's something that we can accomplish. But another way that we did that knowledge translation was through our case competition. So I kind of mentioned it at the beginning, but as a team, we split it into smaller teams, and we participated in the Partners in Health Global Health Case competition in September of the previous year. And that was a great way for us to actually get to know each other. It was one of the first times that we were all meeting in person. And so we kind of got to know each other through this case competition, and also, again, learning how to work with one another from our diverse backgrounds. And this was right before our programs had started. It was in the beginning few weeks. So I think we didn't have as much knowledge as we did going in January, but we still had very diverse experiences in health, in health, research, in working with patients, and even extracurricular activities. We were very diverse in that sense. So I think we taught each other a lot in that sense. And it was such a great experience for us that when we planned to host our own case competition in April a few months ago, we actually reached out to Partners in Health Canada, and they were more than happy to actually host the case competition with us in collaboration. So it was a complete full circle moment to us from the beginning of the year to the end of the year. It's like starting with PIH, ending with PIH. So that was a really nice moment for us. And that was when we kind of had that kind of knowledge translation aspect from what we gained throughout the year, we were able to pass on to other students. So our case competition followed a 2-day format. And on the first day, we had workshops where myself and 3 of the other board of directors and another student from the MBI program, we held short mentoring kind of session, basically teaching about these key skills that you need for a case competition, right? How to deliver an effective presentation. When you're making a global health solution, how are you defining the problem? Is it clear? How are you presenting your solution? Is it, fundable? Is it trustable? What is the background of this innovation? And how to deliver this all effectively, how to make sure you have the evaluation that you have an evaluation plan for your innovation. When are you going to make sure that you are delivering on these goals that you are proposing? So all of these things were things that we wanted to discuss in that workshop session and give all of this information to our case competition participants to help them succeed in the competition. And afterwards, we also had a short advising session. So with us, the speakers, they could come up to us and ask us any, their own solution specific questions on delivering their solutions. And the second day we had advising sessions with professors that were experts in this field. So they were able to speak to them and ask. One of our experts was actually in our host country in Malawi. So she was able to give a really great insight into what the problem is and what the biggest barriers are to reaching the target population in that area. So I think in that sense, we were able to pass on what we learned and also connect them with experts, because that is part of, making a good solution. You want to connect with the people that you're actually trying to help, learn from people that have done these kind of health solutions before.
Yeah. Now, that's very impressive that you guys were able to get that sort of connection worldwide. So in your first year, I do remember, I think I joined one of those workshops in the first semester that we had. That you guys ran. I think you guys ended up making it online because of...
I think that was the information session.
Yeah.
So this workshop was so this workshop was in the case comp.
Yeah, no, these ones were later in the year. I think I was in Europe at that time, so that would have been potentially different. I don't know. But no, I remember you guys having these events throughout the year and trying to as a good way for people to get involved and everything. And I mean, we've been lucky enough in ASH to also have companies for case comp just with us, and it's surprising how much like if you do enough work, like you don't have to go overboard, but if you show these organizations that you are actually doing something for genuine reasons, that they are willing to give students a chance, especially if they're like, you know, first year of starting or first year of a club. I think you kind of went over the history of MIGH to begin with, but so I just want to clarify. So you guys were the first year to do this. Were you there from like the inception of the idea, or was it like I think the president is Ritika? So can you just quickly, you know, maybe say like who came up with it? You know, was it your brainchild? Did someone else steal it? Or, you know, who's who's the reason for all of this to kind of started?
Yeah. So Ritika and Shruti are the co-founders. So this was their idea that they came up with together. And then they reached out to potential graduate students that they thought had an interest in interdisciplinary teams in health. And they reached out to a bunch of students across the graduate programs in McMaster. So I was recruited by them, and I was part of the original and current BOD team. So since August up to now.
Damn, I didn't get recruited. I didn't get no invite.
Sorry.
It's okay. No, it's okay. Some people. No, but that's actually really cool that like they came up with it and they reached out to people to get them involved and all that. Like I think that was a very like good way to get it started, and it's done really well for its first year, and I think it's for any year, I think, honestly. So hopefully you guys you know, keep it going, or but we'll get to maybe the future plans of MIGH a little later. Omar, any thoughts?
Yeah, no. It's just hearing the whole story is like really, really inspiring, especially for people who may have ideas like this, but they don't have the courage to kind of start it. You know, that's kind of what Ali and Ash was in the first year. We had the idea, but we're like, I don't know. It's just like it's just constant doubts and stuff. But to see success from initiatives so early on is just inspirational. And I know this is student-led, right? This is a student-led initiative. Yeah. So in terms of like, you know, in comparison to maybe traditional organizations that are not student-led, that have become more like, you know, a foundation or something, do you feel that being a student-led initiative gives you any advantages or freedoms that maybe a traditional health organization wouldn't have? And I really want to know that because we also are like kind of student-led as Ash, and we've noticed that there's been a lot of things that we're able to do like on our own with like our own control and maybe our own ideas, but sometimes there's the thought of whether we should take it to the next step. So I'm just curious from your guys' perspective, since you've had so many interactions in the field, how do you feel about that like comparison between the two?
I think having a student-led group is very helpful, I think, when you're starting out, because each student comes with their own network, their own academic network, their own personal network. And I think that really helps with getting your name out there, being able to reach out, not just in terms of like connections, but also making those connections with people that you want to be mentors for the club, that you want to guide the club. I think, you know, we are student-led, but we do have some professors that are constantly giving us advice on what to do next. And we also reach out to faculty at McMaster and ask them what they think we can do to improve our, you know, what we're trying to achieve with interdisciplinary actions in health. And I think being a student-led group in that sense is really helpful because you have that network, but also because you're surrounded by faculty, and these faculty are often leaders in their field, right? And I think even connecting with alumni that way, I think even if you had a student group that was from different universities, that's even better, because you, again, expand your alumni network, and you are able to find pretty much many more people in whatever field you're looking into. I think that really helps. I think as opposed to a non-student-led group, I think, I mean, I haven't been part of a non-student-led group, so I can't say for sure, but I would say that I think the network aspect is really important. And I feel like the incentive for people to participate and your viewership, your audience increases being a student-led group, because I think students see themselves in the team, right? If it's just a team of individuals that are at mid-career level, they might not identify with that. They may not think that that's something that they can achieve. But like you said, when you see initiatives led by students, you also feel inspired to do something, to get involved with that initiative, to start your own. So I think with that sense, you have a lot more engagement from peers and from individuals that are younger, or even alumni, right? They want to come back and help those that are trying to get involved where they are.
Yeah. No, I think definitely those are a lot of things that you have an advantage of when you're a student-led group. Also, I think for you guys, it's great that you have that partnership with McMaster as well. So you have that, like, you know, you can go to the faculty, you can go to people and like professors. More importantly, you guys get funding. We don't. And Ash, everything comes out of our pockets. Not for a lack of trying, but no, I do think like when you're a student-led group, you have that sort of like freedom in some way where you're not maybe bound by, you know, a big organization and like the way they want to do things, even if not saying it's bad, but if you disagree, you don't have that option, because surely there are clubs like that are maybe at MAC or affiliated with MAC, but they are part of like a much bigger organization that has clubs at every university or something like that. So you have to do things in like a very particular way. So being like a new club, or you guys being on your own, even though you're affiliated with MAC, because you've created this and you've started it, right? It's basically yours to do whatever you want with, change it up, you know, make it bigger, make it smaller, make it more directed on one particular thing, more vague, etc. So I think those are definitely like, it's a good way to, especially when you're starting out. But kind of leads me into asking, I think now that you guys are here, you know, your first year is, I mean, it's basically finished, right? Your first year of the club, I'd say, it's coming towards an end. You've done case comps, you've done a lot of workshops, you've done a lot of good things. What's the future? Because, you know, some people are graduating their master's, some maybe still doing another year. What's the plan for maybe you and or MIGH? Like, what's the plan for the club going forward?
Yeah, thanks. So great questions. You know, I think that's one thing that even a lot of our global health faculty have asked us. They've seen what we've done so far. And their next question, I think the first question they asked was, so what are you doing now that the program is ending? What's happening with MIGH? And it's a very valid question, because you invest a lot of time and effort, and we are so connected to the club. We are so proud of the things and grateful for the things that we've accomplished, that we wouldn't want that to go to waste, of course. And of course, we're making these plans to continue the team afterwards. I can't give everything away as of right now, but we are
gotta gatekeep it. Gotta keep it. Close your ears, everyone.
All right.
Internal comments.
Just tell us. We'll cut it out of the video.
It's fine. We're keeping on the same. We're keeping on the board of directors, because we do value the leadership that we've had so far, and we are, however, hoping to expand our team with current students. Because again, like we mentioned, like that academic network, that student-led network is really important. And we also want to give opportunity for new students to get involved. There's incoming global health students, there's incoming MBI students, there's MBA students that have already been admitted. I think the final round of admissions is still going on. They have a lot of rounds. And we're also open to all graduate programs, right? We're interdisciplinary, so we're looking at people even to join if they'd want from the Faculty of Engineering, from the e-health program. So, you know, anyone with that interest in medical innovation and global health. And we're actually hosting our alumni night next week on Thursday night. And again, we're bringing in alumni that have been working in their fields for the past 2 or 3 years. And they are from these programs, from these MBI, MSc Global Health, and the MBA programs, a couple others. And want them to come back and basically talk about their experiences. How has it been after completing their graduate degree? What was career, job hunting, but also their career projection afterwards? How has it been going? And I think that's going to be really valuable for incoming students to hear. And it conveniently coincides with the same week that we're releasing our applications for our executive team for the following year. So all putting it together to continue for next year.
What about new alumni from Global Health? Are we allowed to come? Just
Yeah, of course.
All right, hey, free food potentially. Are there food?
Oh, it's online.
Ali's not coming. That's confirmed.
We decided to make it online just so it's easy because everyone's in different places for the summer. So
I got food at home. I still might show up. I just might.
You can bring your snacks to the meeting.
Yeah, sure. I don't know, Omar, I don't know. Do you have a question?
No, I think she answered. I was gonna ask more about like what's next too, but like I think she covered most of it. I don't know how we're doing for time. My phone.
We are now at like 29 minutes and 50 seconds.
So we'll be close to wrapping up now probably. I see, Ali, you have added a rapid fire round.
I thought it might be fun, right?
Yeah, no.
Nice
That's fine. That's fine.
Or quick.
Yeah, of course. So quick rapid fire round questions for you.
Okay.
No pressure. So just say what comes to mind. Just say what comes to mind.
All the pressure.
Oh, okay.
Ali
seems
like he's in a different call
altogether.
But okay. First question is one word that describes MIGH or Medical Innovation Global Health. Collaboration. Okay, yeah. I think I was thinking that too, but I think that's the first thing that usually comes to mind when we hear something like this.
Usually, like collaboration, interdisciplinary, these type of things, and they fit, right? Especially with the way
it does. If you were to describe in one word, I think that makes sense. Okay, one innovation in global health that excites you.
Oh,
it could be something that you guys have thought of. It doesn't have to be like.
Actually, I have a great. So, the co-founder Shruti is working on this directly with Dr. Esther Chin, but she has an amazing medical innovation called Stitch, and it's her own startup, and it's working to address women's health issues. And I think it's really interesting. I am blanking on the details because of this rapid fire, but it is really, really interesting. She was one of our panelists at our case competition, and she actually brought a expanded size prototype of the Stitch innovation for just for the members to see, the attendees to see. So that was really interesting.
That's quite impressive. Oh, yeah. I hope it works out. I hope it does really well, because I mean, you'd love to see that with students coming 100%. Up with things, mid or like during their masters and actually becoming something, because especially when it's for a good cause. Okay. Next question. What is the most underrated skill for student leaders?
I think I'm actually going to say maybe this is a bit controversial, but I think humility. I think it's really important to recognize what you don't know. I think, when we think of leadership, you think of, I am excelling in communication, I'm excelling in managing people, et cetera. But I think as a leader, you have to also recognize where you lack and where you don't have experience, right? And you can obviously grow and improve your skills, but I think it's important to recognize where your experience or where your knowledge falls short, because a leader doesn't have to know everything, but they should know what they don't know so that they can connect their team with the people that can help them the most. So I think humility is important.
One, honestly, very, very good answer. I think Omar, you did that very well in ASH. I did not, but I wasn't leading, so I didn't have to. Okay, last question. Advice to someone thinking about starting an initiative like MIGH, preferably aside from the humility thing, but like something else.
Yeah, I would say be confident and be persistent. If you have an idea, if you're persistent and you work hard, I think that people will recognize the efforts that you're putting in and they will want to get involved. Even if you have the smallest inkling of what you want to do, as long as you work on that gradually and consistently, you're able to develop a much better understanding of what your project or what your event or what your initiative might be. And asking for help is really important. Once you have an idea, be confident and reach out to people that you think would be interested. I think a lot of the times we're kind of afraid to ask people, like maybe they're going to not be interested, which is fine. The worst case is a no, right? Or you think that they might judge you or something. But I think that that's just, irrelevant things that shouldn't bother you. Because if you really want to do something different, you want to change, you have to get comfortable with being uncomfortable. So being confident and being persistent, I think, is really important.
Yeah, no, I think 100% that's good. That was really good rapid fire answers. I think that was pretty solid. Yeah. I don't think Ali and I would have came up with something.
No, but I'd be like, ChatGPT.
No, but no, that makes.
They do that in Zoom calls. Have you seen that extension that people have?
They have that now here.
Bro,
yeah, there's like jokes about it online and stuff. Like it'll like listen to your call and then it'll suggest things for you to say.
So
this is
careful
dangerous
doing
now.
a Zoom interview anywhere, honestly.
That is insane. Now bound to happen, but insane. Yeah, crazy. I think we've learned a lot. So we have reached towards the end of the episode, guys. Amal, thank you so much for being here. First of all, sharing your insights, your energy, experience with us. I know whenever we get guests, the listeners benefit a lot, but some things that people don't think about is that the co-hosts also benefit a lot. We learn a lot from our guests. It doesn't matter if they're students or experts, like your experiences and stuff really teach us more about things that we've never thought about before. And even if we have just a unique perspective, it builds a powerful conversation. So that's really good. And I think our listeners will walk away with a deeper understanding of how important innovation is, health system efficiency, and just all the amazing tips and advice you gave. I think there's definitely something to take away from this episode. I may even re-listen to this episode just to see some tips that I can think about too for healthcare. But thank you so much for that.
Yeah, couldn't agree more.
Thank you so much for having me.
Of course, like I thank you again, like for me as well, that you agreed to do this. We will link you as well if you want. We could even try to link some of the board of directors if they feel interested in that in the episode description. So when we put it out on LinkedIn or Instagram, depending on our graphics, we could even try to put in like your guys' logo or something about your club into it to try to integrate it in somehow. Of course, the name will probably be there, but like also integrate the logo and stuff. So yeah.
Thank you so much.
Yeah.
Thank you for having me. It was really great having these conversations. You raised a lot of really good questions, and I really like the rapid fire round. It kept me on my toes.
Let's go.
Ali definitely enjoyed making those.
I did.
Yeah, no, it's good. It's good. But yeah, I think that wraps up this episode of the Ash podcast, guys. If this conversation resonated with you, give us a follow, share the episode, and keep amplifying voices and people like Amal that are pushing for a change.
Yes, definitely what Omar said. Check out this podcast, check out the other episodes, check out look at the amazing things they're doing. Until next time, stay curious, stay kind, and stay tuned because we will be back soon with more. Thank you.
Thank you.